Mucormycosis, often referred to as black fungus, is a serious but relatively rare fungal infection that can have devastating consequences if not treated promptly. It is caused by a group of molds called mucormycetes, which are naturally found in the environment, particularly in soil, decaying organic matter like leaves or wood, and even in the air we breathe. While they're generally harmless to most people with healthy immune systems, they can cause severe infections in individuals with weak immune systems. This condition happens when mucormycete spores are inhaled or come into contact with the skin through cuts, scrapes, burns, or other forms of trauma. Once the spores enter the body, they can rapidly invade the blood vessels, causing tissue necrosis or death due to the interruption of blood supply. This characteristic necrosis is one of the reasons mucormycosis is so dangerous, as it can quickly lead to severe damage in the affected areas. The infection is particularly aggressive in individuals with weakened immune systems, such as those with uncontrolled diabetes, cancer patients undergoing chemotherapy, organ transplant recipients on immunosuppressive drugs, or those with severe burns or injuries. Mucormycosis isn't a common infection, but its incidence has been rising, especially in certain parts of the world. During the COVID-19 pandemic, a significant rise in cases was observed, especially in countries like India. This increase was largely attributed to the use of corticosteroids, which were a treatment for COVID-19 that can suppress the immune system, and also due to the high prevalence of diabetes in the population. In developed countries, it remains rare. Only 1 to 2 people per million get it each year. Types of mucormycosis. The infection can affect various parts of the body, leading to different types of mucormycosis. The main types include: number 1, rhinocerebral mucormycosis. This is the most common form, and it affects the sinuses and brain. This type often starts as a sinus infection and can quickly spread to the brain, causing severe neurological symptoms. Number 2, pulmonary mucormycosis. This type affects the lungs and is more common in people with lung-related issues or those who have had organ transplants. Number 3, gastrointestinal mucormycosis. Although rare, this type occurs in the digestive system and is more commonly seen in premature infants or those with severe malnutrition. Number 4, cutaneous mucormycosis. Cutaneous mucormycosis affects the skin and can occur after an injury or surgery. Number 5, disseminated mucormycosis. This is the most severe form, and it occurs when the infection spreads throughout the body via the bloodstream. Causes of mucormycosis. At its core, the infection occurs when spores of mucormycetes fungi enter the body. This can happen through breathing in the spores, through a cut or burn on the skin, or in rare cases, through contaminated medical equipment. However, simply being exposed to these spores doesn't necessarily lead to infection. Our bodies have natural defenses against these fungi. However, when the immune system is weakened or compromised, the body's ability to fend off these fungi diminishes, allowing the spores to grow and spread within the body. One of the primary risk factors for mucormycosis is uncontrolled diabetes, particularly diabetic ketoacidosis, which is a condition where high blood sugar levels lead to the production of acidic ketones in the blood. The acidic environment in the blood promotes the growth of mucormycetes, making diabetic individuals particularly vulnerable. Other conditions that suppress the immune system, such as cancer, HIV or AIDS, and organ transplantation, also increase the risk significantly. Corticosteroids, which are often used to treat various inflammatory conditions, can also suppress the immune system and increase vulnerability. Similarly, some medications used in cancer treatment or to prevent organ rejection after transplantation can have a similar effect. Trauma or injury to the skin can provide an entry point for the fungi, especially in individuals with compromised immunity. This is particularly relevant for cutaneous mucormycosis. Iron overload in the body, which is a condition called hemochromatosis, can also make someone more susceptible to mucormycosis. The fungi that cause this infection thrive on iron, so having excess iron in the body can fuel their growth. Symptoms of mucormycosis. The symptoms of mucormycosis can vary widely depending on the type of infection and the part of the body affected. Number 1, Rhinocerebral mucormycosis. In rhinocerebral mucormycosis, which is one of the most common forms, patients often experience facial swelling, particularly around one eye. This can be accompanied by a stuffy nose, nasal discharge, and severe headaches. As the infection progresses, it can lead to black lesions on the palate or nasal bridge, indicating tissue death. Patients with rhinocerebral mucormycosis often describe a feeling of intense pressure or pain in their sinuses. Some report a sensation of fullness or congestion that doesn't improve with typical treatments for sinus infections. As the condition worsens, they may experience blurred or double vision, and in severe cases, even blindness in the affected eye. Number 2. Pulmonary mucormycosis. Pulmonary mucormycosis typically presents with symptoms similar to other lung infections. Patients may experience fever, cough, chest pain, and difficulty breathing. However, the progression is often more rapid than with typical pneumonia, and patients may cough up blood as the fungus invades blood vessels in the lungs. Number 3. Gastrointestinal mucormycosis. In cases of gastrointestinal mucormycosis, patients often experience severe abdominal pain, nausea, and vomiting. They may also notice blood in their stool. The pain is often described as intense and diffuse across the abdomen, reflecting the widespread nature of the infection in the gastrointestinal tract. Number 4. Cutaneous mucormycosis. Cutaneous mucormycosis usually starts as a painful, red, and swollen area of skin that quickly turns purple or black as the tissue dies. Patients often report that the affected area feels unusually warm to the touch and is exquisitely tender. In some cases, they may notice a cotton-like growth on the skin, which is actually the fungus itself. Number 5. Disseminated mucormycosis. Disseminated mucormycosis, being the most severe form, can present with a wide array of symptoms depending on which organs are affected. Patients often feel extremely ill, with high fevers, confusion, and multiple organ dysfunction. Diagnosis of mucormycosis. Diagnosing mucormycosis can be challenging, as its symptoms can mimic other conditions. Doctors typically start with a thorough medical history and physical examination. They'll ask about recent illnesses, medications, and potential exposures to environments rich in fungal spores. Imaging studies play a crucial role in diagnosis. CT scans or MRIs can reveal characteristic signs of the infection, such as sinus involvement or lung lesions. However, these findings aren't specific to mucormycosis and require further investigation. The gold standard for diagnosis is direct microscopic examination and culture of affected tissue. This involves taking a biopsy from the infected area and examining it under a microscope. The thread-like structures of mucormycetes have a distinctive appearance, being broad and lacking septations or internal walls. Culturing the tissue sample can also help identify the specific species of fungus involved, although this process can take several days. In recent years, molecular diagnostic techniques have been developed to detect mucormycetes more quickly. Polymerase chain reaction, or PCR tests, can identify fungal DNA in tissue samples or blood, potentially allowing for earlier diagnosis. Treatment for mucormycosis. Once mucormycosis is diagnosed or strongly suspected, treatment needs to begin immediately. The cornerstone of treatment is the prompt administration of antifungal medications. Amphotericin B, particularly its liposomal formulation, is typically the first-line treatment. It's given intravenously and works by disrupting the fungal cell membrane. Other antifungal medications, such as posaconazole or isavuconazole, may be used in combination with or as a step-down therapy after initial treatment with amphotericin B. These drugs are often better tolerated and can be given orally, allowing for longer-term treatment. Surgical intervention is often necessary alongside antifungal therapy. This involves removing dead and infected tissue, which is a process called debridement. In rhinocerebral mucormycosis, this might involve surgery on the sinuses or even removal of the eye if the infection has spread there. For cutaneous mucormycosis, infected skin and underlying tissue might need to be surgically removed. The extent of surgical intervention can be quite extensive and may require multiple procedures. While this can be disfiguring, It's often necessary to stop the spread of the infection and save the patient's life. Even with aggressive treatment, mucormycosis remains a serious condition with a high mortality rate. Survival rates vary depending on the type of mucormycosis and how quickly treatment is started, but overall mortality rates can be as high as 50% or more. Now, we want to hear from you. Have you or someone you know ever had to deal with a serious fungal infection like mucormycosis? How did you handle it, and what was your experience with the treatment process? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.